everybody, Menachem Brodie here with you once again from Human Vortex Training, your certified and experienced USA Cycling expert level coach and strength and conditioning coach. Here today to talk about foot and knee alignment on the bike. Whether you're on a spin bike or you're on a mountain bike or you're on a road bike, we actually are looking for pretty much the same things. As a bike fitter, I've seen a lot of individuals come in and while we tend to think that we are all alike, we need to remember there's a couple different variations that naturally occur in our hips. So something that I found very interesting is that there was a study done that showed that 1 out of every 3 hips, so I have 2 hips and you have 2 hips, 1 in those 3 will have a variation in the femoral neck angle. So if this is our upper leg bone, this is the ball and socket joint part of the bone, and then we have the neck, we can have a 5 to 20 degree difference in the femoral neck angle in one of our 4 hips. Now that is astronomical when you look at it from a biomechanical standpoint, because it really changes how that joint is going to function and how the body's going to align. So we have to keep that in mind as we're thinking about knee and foot alignment on the bike, and we'll look at a video here in a minute. But we need to keep in mind that our hips are not exactly alike, even though we think of ourselves as being symmetrical. Like for example, Julia Roberts, up until recently, was said to be the most symmetrical face. They found someone, I believe, in Ireland who's even like 99 point something percent symmetrical, and that's the most beautiful face. Beautiful in air quotes, it's your opinion, but the most beautiful or attractive face because they're symmetrical. But most of us are not symmetrical. One arm is going to be longer than the other. One leg is going to be longer than the other. One foot, and this is something that's really cool from bike fitting that I learned, is one foot is a little bit bigger than the other, and that's normal for us. So as we go through this, it's important for us to remember that there's different variations in the hip, and leg length, which can really affect the alignment. But as a general rule, what we're going to see here in this video is what we don't want to have for a foot and knee alignment. So this is a rider who popped into one of my indoor cycling for endurance athletes programs a number of years ago, and her foot and ankle were so off, I asked her, can I please take a video of you because I want to show you what's going on. And she was complaining of lower back pain and on her left side and her right shoulder bothering her. So if you look at the video here, you can see that her knee comes in and her toes are angled in as well, where her heel is flared out. And this is really important for us to notice, and a lot of us don't. So it may take someone taking a video of us up front or from the front to be able to see what exactly is going on. Now, there's a number of considerations when we look at as far as the cleat system. So here we have an SPD cleat. The reason I chose this for the example today is because some of you guys are going to be in spinning class or on spinning bikes or just beginning as cyclists, and this is the easiest pedal and most reliable pedal as far as I'm concerned, as far as pedaling surface, that will allow you to be able to go out and ride and explore your abilities. Now, a couple of things we want to keep in mind is that the cleat system, and you can see I did a little bit of field riding the other day. I tried to clean these the best I could, but we want to have the cleat at the ball of the foot, so right where that big knuckle on the toe is. So we want to have that lined up right down the middle so that when you're pushing, it's just like when you're running. We want to have that pedal right at the ball of the foot, so it's just like that proper running motion where you're able to push down and through. Now, when we have the cleat lined up, not everybody is going to be cleat neutral. So, and it's not uncommon, as we talked about with the 1 and 3 hips, for one foot to be slightly toed in or slightly toed out in order to keep the ankle, the hip, and the knee in a straight line. And that's really what we're looking for as a bike fitter, is we can slant the forefoot just a little bit through an inside the shoe wedge where it kind of puts you up or down a little bit. Usually it's up on the outside, so that brings the knee in. Or we can use an outside the shoe wedge, which goes underneath the cleat. So if you look at my How to Change Your Keel Cleats video, you'll actually see what those look like. And that shifts the whole foot, not just the forefoot, as well as having the inserts, the arch support as well. So Specialized has a variety that you can buy, which will give you more or less arch support, because a lot of the cycling shoes we have a very stiff bottom. The point of a high quality and expensive cycling shoe is to have as stiff of a bottom as possible, one piece of carbon fiber, so that you put all that force that you're placing on the shoe all the way down through the pedal into the crank to turn the cranks to move the wheel and propel you up the road, as opposed to losing some, as we see here in this commuting shoe where it kind of bends. That little bit of lost energy translates to a lower percentage going to the pedals, to the cranks, to the wheel, which costs you over time. So what are we looking for overall when we have that cleat pedal interface? So when we have alignment, we're talking about essentially the knuckle of the big toe. And this is important. The knuckle of the big toe should be in alignment with the center of the foot, and that should line up with your knee and roughly the center of your hip. Why do we say roughly? Because sometimes people don't have the hamstring flexibility, or they don't have the glute and core strength to be able to be at 25 to 30 degrees of extension. Sometimes they have to be at 30 to 35 degrees of knee extension, and that can negatively affect how they're sitting on the bike, and that can also bring their knees up and out a little bit until they get that strength and range of motion and that balance at the hamstring, the glutes, and the core. So we have that range at the knee of 25 to 35 degrees, which is a soft bend. If you want that quick setup when you go into spin class or you get onto the spin bike, put the pedal at dead bottom center, so 6 o'clock on a clock. So you want to have it down at the dead bottom. So here we have the clock, we want to be at 6 o'clock. Most of us are thinking of dead bottom as 5, where our foot is kind of straight, our knee is kind of straight, but we want to be down at 6. And the quick guide is just make sure that you can touch your heel comfortably to the bottom, the center of the heel, to that pedal, and that'll give you roughly, usually, a 25 to 35 degree. It's a quick guide, a rough guide, but that's what we're looking for when we're talking about alignment. We want the hip, the knee, and the ankle, and the big knuckle, the big toe knuckle, to be in a straight alignment, pretty much straight up and down. So sometimes we'll see that toe will come in a little bit, but we don't want to be quite as in as that the female in the video was, because that can do negative things to the rest of the body. So if you notice, you look down and see your knees are coming up and over the crossbar, or up towards the middle, or maybe even they're hitting, or you notice your knees are coming up and out, that can be a sign that you don't have good seat height, or the seat may be too far back or forward. Usually when you come out with the knees are coming up and out away from the pedal, that's usually a sign that either your tensor fasciae latae, a small muscle on the side here, is very tight, or that your saddle is too low or too far forward. But one of those, it's usually going to be too low. If you feel the knees coming up and in, it could be a number of things. It can be that the saddle's a touch too high. It could be that your glutes are not firing and the tensor fasciae latae is kind of given up on doing its job, and that the adductors are overactive, and that can be a number of causes for that. So these are the considerations and how to look at foot, ankle, and knee alignment when you are getting onto the spin bike or your bike. If you have a road bike, a mountain bike, or a cyclocross bike, or even rails to trails, and you notice that your knees are doing funny things, or that your hips are sliding side to side, as we see here, it's really important to go in and have a proper bike fit time. An expert bike fitter can do wonders for you and help you really enjoy the sport of cycling from now until 50, 60, 70, 80, 120 years into the future. But the important thing is to address this issue before you have issues, before you have pain. And it's really difficult to do that because we don't think of it. But you're here watching this video, so check it out. Make sure you're looking straight down. Make sure that the big knuckle of the big toe is lined up with the pedal right down the middle. So if you don't have cleats, just find that happy medium where the pedal is pushing right below the ball of the foot, or if you were to raise up onto your toes a little bit, where that last knuckle is before you go on your tippy toes. And that will help keep you guys nice and healthy. So knees, ankles, and hips in a straight line, and that hip is going to be right in through here, and make sure your knees aren't doing anything wonky. Up and out usually means the saddle's too low. Up and in can be the saddle's too high, or you have weak glutes or overactive adductors. I hope you guys found this very informative, and it will help you resolve the issues that you have. Remember to subscribe below, give me a thumbs up, and let me know, what was it? Was the saddle too high? Was it too low? What was going on with you? And what did you find was the fix? Remember, until next time, train smarter, not harder, because it is all about you.